Explain the effect of diabetes on human behavior, we're going to talk about what is diabetes. Diabetes is a chronic, long-lasting health condition that affects how your body turns into food into your energy. It also occurs when the pancreas is no longer able to make insulin or when the body cannot make good use of the insulin it produces. When we say insulin, it is a hormone made by the pancreas that acts like a key to let glucose from the food we eat pass from the bloodstream into the cells in the body to produce energy. Not being able to produce insulin or to use it effectively leads to raise glucose levels in the blood. Therefore, that can cause serious health problems such as heart disease and so on. There is no cure yet for diabetes, but losing weight, eating healthy food, and being active can really help. Taking medicine as needed, getting support, and keeping healthcare appointment can also reduce the impact of diabetes on your life.
The type 1 diabetes. What is the type 1 diabetes? It is an autoimmune disorder which the body immune system mistakenly attacks the healthy cells in the pancreas. When enough of these cells are destroyed, the body can no longer produce insulin and the glucose starts building up in the blood. Type 1 diabetes can progress very rapidly. Symptoms can suddenly become very severe within months or weeks. The type 2 diabetes. The type 2 diabetes is one of the most common diabetes of them all. With the type 2, the pancreas keeps making insulin, but the body becomes resistant to it. That means that the insulin gradually stops working and the glucose starts to accumulate in the bloodstream over time. With type 2 diabetes, symptoms develop slowly, often over years, so you might not notice the problem until the disease is quite advanced. While genetics can be risk factors for type 2 diabetes, age, diet, and lifestyle also play a role. You are more likely to develop type 2 diabetes if you have excess weight or are not physically active. You're also more likely to develop type 2 diabetes later in life, although you can diagnose it at any age.
The third one is gestational diabetes. During pregnancy, an individual's insulin sensitivity decreases, resulting in gestational diabetes. Each year, about 2 to 10% of pregnancies result in gestational diabetes, according to the Center for Disease Control and Prevention, CDC. People who are overweight before becoming pregnant have a higher risk of having the illness. And lastly, prediabetes. Prediabetes, also known as borderline diabetes, is a condition in which a person's blood sugar levels are high but not high enough to be diagnosed with diabetes.
Due to the effects of diabetes into one's body, it also affects their mental health and the people around them. People that are suffering from the disease can be more aggressive. They can be experiencing irritability and mood swings. Addition to that, they can also have difficulty in concentration. They can also experience distress due to their situation because of what the disease makes them feel. Not only they suffer having diabetes, but it also affects their relationship towards their family or the ones that take care of them. Some of the people that suffer diabetes can also have symptoms of depression, but not to the point that they are diagnosed by it. They are also anxious because they worry about the going up and down of their glucose or sugar level.
Cause and symptoms of diabetes on human behavior. Having diabetes can lead to a mental health condition that doctors call diabetes distress. This condition shares some elements of depression, anxiety, and distress. Diabetes can affect a person's mood behavior, causing rapid and severe changes. List of symptoms of low blood sugar or what we call type 1 diabetes. Number 1 is confusion. Number 2 is hunger. Number 2 is coordination and decision-making difficulties. Number 4 is aggression and bad temper. For high blood sugar or type 2 diabetes, feeling nervous, feeling tired, low energy, and difficulty thinking clearly and quickly. Causes of diabetes to human behavior. Number 1 is changing dietary behaviors, changing physical activity behavior. Number 3 is lack of sleep, poor sleeping habits. And lastly, stress.
Did you know that there are three types of diabetes? First is autoimmune disease, wherein the body doesn't create enough insulin for the body because the immune system is attacking the pancreas that creates insulin. Next, diabetes is caused when the body doesn't create enough insulin for the body. And third is gestational diabetes that only occurs in pregnancy and usually disappears after giving birth.